Hello, everyone. My name is Kimberly Prado, and I am a postdoc at UT Austin. I'm an epidemiologist and a promotora as well. I will today present on my pilot project, Texas Ag Worker Cardiovascular Disease Perception, Risk, and Health-Seeking Behavior. Thank you for your attention. My objective was to address gaps in CVD research and disparities in health awareness and treatment among ag workers. And with a total worker health emphasis, which helps us move beyond concentrating on work safety and protection to recognizing social determinants of health among agricultural workers. Other goals included to reduce the risk of work-related illness, increase surveillance, and reduce the risk of illness and injury in this vulnerable population. For CVD, we wanted to understand mechanisms, risk factors, and develop and evaluate possible workplace interventions for cardiovascular disease among ag workers. These are essential workers. Total Texas ag sales in 2017 were 25 million, with 56,000 farms hiring ag workers. And at any given time in Texas, there's roughly 360,000 migrant and seasonal agricultural workers. This is significant because cardiovascular disease is the leading cause of death among Hispanics, the majority of ag workers, with risk factors including hypertension, diabetes, obesity, and smoking. And these factors increase the risk of ag workers suffering cardiovascular disease fatalities because of occupational hazards like COVID-19, heat-related illness, pesticide exposure. Other risk factors that they have include poor diet, food insecurity, low food literacy. And research has shown that cardiovascular disease incidence does increase among workers in a hostile organization. And all of these factors combine and intersect for ag workers to have worse cardiovascular disease health outcomes. Also, risk factors have been seen to change based on sex and migrant seasonal working status. But we do have effective diabetes and CVD risk screening tools provided by community health workers among agricultural workers. Now, my methods included a mixed method sequential exploratory design, a community-based participatory research approach with a community advisory board, including focus groups and surveys, and utilizing a workplace intervention called Pasos Saludables. So now our research is a community-based approach, inviting employers, stakeholders, advocates, workers, and community health workers to have input. And we're using a community-engaged, non-invasive, low-cost screening tool. Again, our approach included focus groups, surveys, and with that, we tracked those who rated moderate to high risk for cardiovascular disease, and we tracked them to see if they sought care, if they sought to receive health education, and we used interviews to investigate their motivations and behaviors. Partners on this project were from North Texas, South Texas, and West Texas. These partners helped us recruit farm workers for focus groups, for surveys, and gave input on research strategy and dissemination, and continuing to work with us until the completion of the study. And focus group topics included general health literacy, questionnaires, vignettes to help them share cases, heart-healthy habit barriers and behaviors for parent and children, and clinic experiences and habits and recommendations for the workplace and community. Under general health literacy, we found that farm workers had a great desire to learn through outreach. Vignettes helped them share cases of diabetes, lupus, cardiovascular disease fatalities, food insecurity, and testimonies of how they try to take care of themselves to keep working to survive. So, cuidándose para poder vivir. This included heart-healthy habits. And heart-healthy habit barriers and behaviors for parents, some of them included that there were no convenient options for securing affordable and healthy foods. In the workplace, there were no lunch breaks for them to eat. In the family, for example, mothers had little support for them when they were rearing the children, keeping the house up, or earning a check for the family. For children in the community, the neighborhoods were dangerous and violent. They didn't feel comfortable going out to play, or they didn't have the options to get healthy foods. And limited family earnings provided processed ingredients, excess sugar foods, and salty foods for children. Clinic experiences and habits revealed severe maternal service disparities when in labor, as well as discrimination based on low-income patients, such as asking for insurance or withholding care because they were low income. Recommendations in the workplace community also showed that they wanted convenient, low-cost resources. And for the survey, the topics that we are going to cover are diabetes, cardiovascular disease, and the NIOSH well-being questionnaire items, and that we'll share later as the study continues to develop. Now, the health resource we used was Pasos Saludables, which emphasized 5 points of moving, drinking water, consuming fruits and vegetables, and measuring yourself and sharing your progress. So this was the foundation of what we could offer for health education. And for dissemination, we have an infographic prepared, policy be prepared. We're developing a cuento to turn it into a radio novela and drafting manuscripts for publication. Now, moving beyond this, we look to further apply what we learned by joining forces between employers and community health workers for cooperative provision of health knowledge among this population. And we also plan to apply for continued extramural funding to increase the reach of these efforts. Thank you for your time.